Let's start today's sessions. It is a part of tutorial lectures. In these tutorial lectures, I am going to discuss about two case studies. One is related to hypertension and another is related to heart failure. So first we will start with the first case study, that is hypertension, right? So what is the importance of the case study? Yes, if we study some particular cases based on the information given in the cases, we can diagnose the subjects based on the information given. So first of all, before proceed to the case study, we must know about the basic definitions of hypertension. It is a very common concept that hypertension is a consistent or persistent high pressures that is against the blood vessels wall, right? So here's hypertension is the persistent increase of the blood pressures on the wall of blood vessels. So here there are many numbers of reasons of consistent increase of blood pressures on the wall of blood vessel. We will learn what are the most important factors responsible for the consistent increase of pressures in the walls, and what are the modifiable risk factors and what are the non-modifiable risk factors. Based on the information given in the case, we will try to diagnose the case, right? So let's start with the first case. What is the information given in the first case? A 55-year-old male visits his family physicians for routine health checkup. He reports no specific complaints as such and feels generally well, but mentions occasional mild headaches which he attributes to stress at work. His blood pressure is measured thrice, 2 minutes apart, in a seated positions after 5 minutes of rest. And the average of last two readings is 152 over 94 millimeter mercury. Other vital parameters and systemic examinations are within normal limits. His previous blood pressure reading taken about 2 months back, that was 144 over 94 millimeter mercury. His body mass index is 28 kg per meter square, and he admits to a sedentary lifestyle. On asking about his family history, he reveals that there is a history of cardiovascular morbidity in his father. So in this particular case, lots of informations are given. First we have to read the case properly, and we have to find out what are the most informations given in this case. Then we will try to use all those informations for the diagnosis purpose, right? After the diagnosis or after the initial diagnosis, based on your diagnosis, you have to justify the diagnosis, right? Here, what are the informations given? Occasional mild headaches, which he attributes to stress at workplace. So, subjects are having mild headache, that is occasional mild headaches. These mild headaches are maybe due to the stress at workplace, right? Now in the second line it is given the average of last two readings, blood pressure readings, is around 152, that is systolic blood pressures, and 94 millimeter mercury, that is diastolic blood pressures, right? We will see whether these blood pressures readings is under normal category or above normal. We will see. Then what are the informations about vital parameters are given? All the vital parameters recorded are normals, and even the systemic examinations also shows the normal limits, right? Now another information is given, that is the recording of blood pressures that was taken 2 months back. So here also you can see the blood pressure's value is not the normal. It is more than normal value, right? And even if you see the individual's body mass index status, based on which we categorize the subject's nutritional conditions. So here it is not in the normal group, right? It is in the overweight category, right? And even if you see the lifestyles of these particular persons, the persons lead sedentary lifestyles, right? Now, on asking about his family history, what reveals that there is a family history of cardiovascular morbidity that was found in his father. So informations are given. So now question is, based on the informations given, what is your diagnosis? See, the pressure is not normal, which persistently increasing. In 2 months back it was 144/94, and recent readings is more than that. It means it continuously increasing, right? Then body weights of the subjects is not in the normal body weight category. It is overweight category or obese category, right? Lifestyle is also not normal. Means the subjects are not involved with any type of physical activities. It leads the sedentary lifestyle. Now, based on these informations given in this particular case, we can say our provisional diagnosis is hypertension. That is the stage 1 or stage 2 hypertension. Now, we have to justify this diagnosis. So, what should be the diagnosis, justifications against the diagnosis? See, according to the reference standards of blood pressure value that is given by American Heart Associations, for the normal blood pressures it is less than 120 is the systolic blood pressures, and 80 millimeter mercury is the diastolic blood pressures. This is normal category. If it is elevated, what we see is there is a little changes of systolic, that is 122, 129, that is the systolic blood pressures, and diastolic is less than 80 millimeter mercury. And in case of stage 1 hypertension, according to the American Heart Associations, it is around 132, 139, that is the systolic one, and 82, 89 millimeter mercury, that is the diastolic one. And in case of stage 2 hypertension, it is graticular 140 for systolic and 90 millimeter mercury for diastolic. So from these informations, these are the reference informations. So if we compare the informations given in the case with the reference informations, we can categorize our subjects. Our subjects falls under this category, right? Because if you see his blood pressure's value, presence value, that is around this, and even the value that was measured 2 months back, it was also more than that reference value, right? So it means the persons falls under this category, right? Now this is our first justification against the diagnosis. So it indicates the persistent high blood pressure means the subjects are under the category of stage 2 hypertension. Now what are the other factors that may correlate with the developments of this, or that may act as a justifications against our diagnosis? That is about the age, family history, the BMI status, and lifestyle. If you see, the person says it is not the young age, right? The subject's age is 55 years. As we know, with the increase of subject's age, there is a high chances of the increase of blood pressure's value, right? So here age is an important factor. And what we have seen in their family history, there was a cardiovascular disease history in the person's father, right? So this is also related with the developments of this. Now the BMI is under the category of obesity. So obesity is also known as a contributing factors for the developments of hypertension. Now last is the sedentary lifestyles. Yes, it means subjects are not involved with the any type of physical activities. He leads sedentary lifestyle. So lack of regular physical activity which can rise blood pressure value over time. So these are the most important factors that may lead to elevations of the blood pressure value, elevations of the blood pressure or persistent elevations of blood pressure value leads to developments of hypertension. This is our justification against the diagnosis. Clear? Now, what are the other informations? See, according to the informations given in the case, what asked here, what risk factors for developing the disease can you identify in the above patients? Yes, what risk factors for developing the disease can you identify in the above patients? Yes, according to the informations given in the case, we can identify the multiple number of risk factors that is related with the hypertension. So what are those risk factors? Obviously, age factors, family history, then body weight status. All these things are known as the risk factors that are most important factors that promotes the increase of blood pressures. Now see, here question is how these factors alters the blood pressures. What is the exact mechanisms or what is the impact of all those factors in physiological point of view? You can see 55 years, which is the age. At this particular age, there is a high chances of increase of risk. What happens actually in this particular group of or age group, there is a changes in the arterial conditions, right? Stiffness may occur. So due to the stiffness of the arteries or due to the changes in the elasticity of the blood vessels, there is a high chances in the pressure increase in the vessel wall, right? So it means age or higher age leads to increase in the arterial stiffness as well as it reduces the vascular elasticity. So both the vascular elasticity or reduced vascular elasticity and arterial stiffness are mostly related with the developments of hypertension. At the same time, if you see the family history, as we have seen, the fathers have some cardiovascular morbidity, which means if there is a genetic predispositions, there is a high chances of developments of hypertension in the subject, right? At the same time, if you see the BMI value here, it is 28 kg per meter square. It is above 25. We know up to 25 comes under the normal category. As it is more than that, means subjects are not in the normal category. It is more than that. Subjects falls under overweight or obese category, and this overweight status leads to changes, some changes into the heart. So what is the changes occurs here? It causes increasing the strain on the heart as well as vascular systems. So due to increase in strain of heart or strain in the vascular system ultimately promotes the developments of hypertension. Now another important thing is that this overweight not only affects the cardiac systems or vascular systems, at the same time it alters the activity of the insulin hormones, right? So overweight leads to, or overweight status is very much linked to the insulin resistance. So as we know, the person who are having insulin resistance, in their case they may develop some comorbidities like diabetes. So these comorbidities also act as an influencing factor for the developments of hypertension. So here overweight or obesity leads to increase in the insulin resistance, right? Here not only the insulin resistance, this overweight status also affects our sympathetic nervous system activity. So there is an increase of sympathetic nervous system's activity. So here both the insulin resistance and increased sympathetic nervous system's activity contributes to the developments of high blood pressures, leads to hypertension, right? Now see sedentary lifestyles. Obviously, as we know, the physical activity is the most important one, which reduces the blood pressures. But the subjects lead the sedentary lifestyles. So what is the physiological impact of these sedentary lifestyles? It reduces the heart's efficiency and contributes to weight gain. So both the reduced heart efficiency and weight gain leads to worsening of hypertension. So this is how all those factors are physiologically linked to the developments of hypertension. Now, next question is, what are the causes of the above disease? We have already mentioned there are multiple numbers of causative factors. Some are modifiable causative factors, some are non-modifiable factors. Here in this question, it is asked, based on the information given in the case, what is your observations? What are the causes of the above disease? Right? So, as we have already mentioned, some are factors which are related to the developments of essential hypertension or primary hypertension, and some are related to the developments of secondary hypertension. So, as I mentioned, the genetic predispositions is a causative factors, aging, causative factors, obesity, sedentary lifestyles, high salt intake and chronic stress. So all these factors are known as causative factors for essential or primary hypertension. So in our case, regarding all those factors or informations regarding all those factors are given in the case. Other than this, there are some other factors that are also known as the causative factors for the hypertension, mainly for the secondary hypertension. So what are those? Like if there is a renal abnormality, endocrine disorders, sleep apnea, some medications and consumption of alcohol. So these are also known as the causative factors, and these factors are mainly involved with the developments of secondary hypertension. If you see the first one, that is the kidney disease or renal abnormality, in this case there is a decrease in the ability to regulate the blood pressures. As we know, there is a renin, angiotensin, aldosterone systems. These systems very much involved with the regulations of blood pressures. So if there is a reduced kidney's ability, obviously it will affect the angiotensin systems. Ultimately it will affect the regulation of blood pressures. So similarly, what we have seen, like in endocrine disorders, there is either hypersecretions of some endocrine hormones or hyposecretions of some endocrine hormones. It means in the disorders of endocrine leads to effects into the blood pressure's value. So what we have seen, it leads to excessive hormone productions. Yes, in some cases we have already discussed many times in our lectures, there are some conditions where there is excessive secretions of endocrine hormones. These excessive secretions is not good for us. So here we have seen excessive secretions causes changes in the blood pressure value or persistent increase in blood pressures. And even sleep apnea is also related with the developments of the secondary hypertension. If you see the medications, there are certain drugs drugs are beneficial to cure certain diseases. At the same time, drugs have several negative impacts too. You can see certain drugs like non-steroidal anti-inflammatory drugs, some contraceptives, steroid drugs, some antidepressant drugs, they also can elevate the blood pressures. So these elevations of the blood pressures leads to the development of hypertension. Now it means, according to the question asked here, we can summarize what are the most important cause for the developments of both the essential hypertensions as well as secondary hypertensions. Now the next question is, what are the physiological derangements in the cardiovascular regulatory mechanisms in the above disease? As we have seen, multiple numbers of factors are involved with the persistent increase of blood pressures. Now question is, how all those factors affects our physiological systems, right? So effects into the physiological systems is called derangements. So here in the questions it is asked, what are the physiological derangements in the cardiovascular regulatory mechanisms in the above disease? So this can be explained by using some mechanisms that are related with the developments of elevated blood pressures, developments of hypertension. So what are those mechanisms? The first one you can see. This includes increased systemic vascular resistance due to chronic vasoconstrictions, arterial stiffening, and endothelial dysfunction with reduced nitric oxide productions. So here you can see, as I mentioned, number of factors are involved with this. So you can see what are the changes that happens in the vascular systems. Increased systemic vascular resistance. Vascular resistance are increased. So if the resistance is high, obviously the flow or the pressure exertions into the vessels wall will be more. At the same time, due to the increased vascular resistance, or vascular resistance are mainly due to the constrictions of the blood vessels, right? And even not only the constrictions of the blood vessels, arterial stiffening is also another important cause for the vascular resistance. And other than this, another important factors that promotes the vasodilatation basically, but here due to the dysfunction of endothelial systems, there is a reduced synthesis of nitric oxide. As we know, the nitric oxide is the most important one which involves the dilatations of the blood vessel. But here in this particular case, due to the dysfunction of endothelial systems, there is a reduced level of nitric oxide productions. So this reduced level of nitric oxide promotes the vasoconstrictions, which ultimately leads to the exertions of high pressures into the vessel wall. This is one mechanism. Another one is the autonomic nervous systems becomes overactive. Yes, due to the overactivity of the autonomic nervous system, some alterations takes place. So what are the alterations? With increased sympathetic tone and reduced vasoreceptor sensitivity, rising heart rate and vascular tone. See, due to the overactivity of this autonomic nervous systems, what are the physiological changes takes place? There is an increased sympathetic tone, right? As well as there is a less sensitivity of vasoreceptors. So here both the increased sympathetic tone and reduced vasoreceptor sensitivity promotes the increased rate of heartbeat and even increase in the heart rate as well as vascular tones. So here both the rise of heart rate and vascular tone are very much related with the developments of high blood pressures as well as hypertension. This is again another mechanisms or physiological derangement. Another important one you can see, the renin, angiotensin, aldosterone systems. it is often overactivated. So due to the overactivations, in excessive angiotensin 2 forms along with the aldosterone productions. Both the aldosterone as well as the angiotensin 2 causes the vasoconstrictions of the blood vessels and changes in the sodium retention capacity, and there is a remodeling of the blood vessels or the vascular systems. So here remodeling of the blood vessels or vascular systems, changes in the sodium retention capacity and the vasoconstrictions, they all are involved with the developments of hypertension. This is again another important mechanisms. Now other than this, like the dysfunctions of kidney that further impaired sodium excretions. As we know, our body needs an optimum level of this sodium, but under certain conditions there is an impairment of sodium excretions. So what is this conditions? Conditions is kidney dysfunctions. So due to the impairments of sodium excretions, there is an increase in the blood volumes. So increased blood volumes also alters or also promotes the pressure rise, ultimately increase in the blood pressures and developments of hypertension. So these are some important pathological derangements that occurs during the developments of elevated blood pressures as well as during the developments of hypertension. Now the next questions given based on the information given in the case, explain the physiological basis of treatments with 2 illustrative examples. Yes, we have the proper treatment strategies for the hypertension. So the most important is using AC inhibitors and calcium channel blockers. Now we will see how these AC inhibitors helps in the treatment process, or what is the exact mechanism of these AC inhibitors. See, it inhibits the angiotensin converting engine. So if there is a less amounts of AC, obviously there will be less amount of the conversions of angiotensin 1 to angiotensin 2, right? So here it inhibits the angiotensin converting enzymes that reduces the angiotensin 2 levels, right? So due to the decreased level of angiotensin 2, it promotes the vasodilatations, right? Ultimately, vasodilatations reduces the blood pressures. Not only this, it also reduces the aldosterone release. So both the angiotensin 2 and aldosterone or reduced level of aldosterone lowers the blood volumes and also lowers the blood pressures. One a mechanism of ACE inhibitor action. In the second one, it is the calcium channel blockers. It is also used as a part of treatments for the hypertensive patients. So what is the exact mechanisms of this calcium or mode of actions of this calcium channel blockers? See, it blocks L-type calcium channels. So these L-type calcium channels basically present into the surface of vascular smooth muscles, right? So here these L-type or calcium channel blockers or presence of these blockers reduces the vasoconstrictions. So it means it promotes the dilation or dilatations, and also it reduces the peripheral resistance. Both the reduced level of vasoconstrictions and reduced peripheral resistance ultimately lowers the blood pressures. So these are some informations that was given in the case. Based on the informations, we analyze the case, diagnose the subjects, and we have also justified about our diagnosis. We have identified what are the most important causative factors for this particular disease and how these causative factors are physiologically related, and what are the most important treatment strategies and what is the mechanism of actions of those treatments, right? This is what is a brief about the first case that I have discussed about the hypertensions. Clear? Now, in the second case, I am going to discuss about the heart failure. Right? So, before discussing about the second case, let me give a brief definitions about the heart failures. Yes, it is also known as the congestive heart failure, which is a complex clinical syndrome which results from any structural and functional impairments of the ventricular filling or ejection of blood. Two things mainly happens here in the heart failures. One is the impairments of ventricular filling, another one is impairments in the ejection of blood. So both the things may happen into the subjects who are having this type of conditions, right? Now, let me start with the case. What are the informations given in this particular case? In this particular case, it is given a 68 years old female presents to the emergency departments complaining of increasing shortness of breath and exaggerated when lying flat during night. She reports having on and off breathlessness for the past 2 months, right? Recently, she had been experiencing such symptoms even with a minimal exertion. Her past medical history includes hypertension for past 10 years and a myocardial infarction 2 years ago. General physical examination reveals edema in her ankles. The heart rate is 110 beats per minute, blood pressure is 100/68, respiratory rate is 28 breaths per minute, and temperatures is febrile. Some information about systemic examinations are also given. Crackles in both lung vases, open auscultations, and distended jugular veins and hepatomegaly. So there are many informations given in the case too. First, we have to read the case properly. We have to identify what are the most important informations given. After collecting all those informations, try to correlate with the definitions. See here, based on the information given, as I mentioned, we are discussing about the heart failures. I mean, this case is very much related to the heart failure. So here, what is provisional diagnosis? Obviously, it is a congestive heart failure. Now we will justify why we call this conditions is related with the congestive heart failures. So this is about the justifications. So what are the informations given? If you see the most important features of heart failure or classical symptoms of heart failure, that is dyspnea or progressive shortness of breath, that is given in the case, right? Progressive shortness of breath over 2 months, and this was observed even at rest. So these information was given in the case, right? So which acts as a hallmark of heart failure? Clear? This progressive shortness of breath over a period of time, it is a hallmark for the heart failure. This is first justification. The second is breathlessness on lying flat. These informations also was there in the case. So here you see, it indicates pulmonary congestions. Yes, this particular conditions is very much related with the developments of pulmonary congestions. So why there is a pulmonary congestions? It is due to increased venous return and reduced cardiac output when supine. देखो, there is a breathlessness on lying flat. So it means the supine conditions, in supine conditions, there is a breathlessness. So why there is a breathlessness? Maybe due to the reduced cardiac output. Clear? So if there is a reduced value of cardiac output, this is also act as a marker of the heart failure developments, right? Another important one is nocturnal dyspnea. See, waking up breathless at night, which is a classical sign of worsening heart failures. So here in the first two, the information for this as well as information for this was given in the case. So based on these informations, we initially can assess maybe subjects are under in these particular conditions. Now, what are the other conditions that may relate with the heart failure? See, bilateral ankle edema. This was also, these information also given in the case. Edema in our ankle. See, bilateral ankle edema, it suggests fluid retentions. Yes, if there is edema, it indicates maybe there is a fluid retentions. If there is a fluid retentions or higher level of fluid retentions, which act as a common features for what? Common features of right-sided heart failure. Clear? So in the case, this information was given. So if we try to correlate these informations with the other informations, then we easily can correlate. Yes, there is a little correlations of these observations with the other findings that is present in this particular case. See, jugular venous distensions. It means it reflects increased right arterial pressures, which is a sign of a right heart strain. So due to the strain into the heart, there is a high chances of heart failure. Clear? So jugular venous distensions is another important classical features of heart failure. And even the information about other pathological conditions was also given, like hepatomegaly, that is annulus livers, and it is likely due to hepatic venous congestions. Due to the venous congestions, there is a development of classical heart failures. So these are some informations that was given in the case, and these informations are related with the developments of heart failure, so called the most important symptoms of classical heart failure. There are several other informations also given, like physical examination findings and past medical history. Like if we say about the heart rate, see, it is not normal, more than normal, 110 beats per minute. If you see blood pressures, it is reduced blood pressures, right? So both these conditions, like first ones, the heart compensates for reduced stroke volume by increasing heart rate. Yes, in this particular tachycardia, where the heart rate is not normal, this high level of heart rate actually act as a compensatory mechanisms to maintain the sufficient supply of blood. So that is why it is mentioned the heart compensates for reduced stroke volume by increasing heart rate, right? See next one, the blood pressures, which is 168, it suggests reduced cardiac output. So reduced cardiac output, again another hallmark for the heart failure. So here it is possible decompensated heart failure. So up to this, we can say these factors or these symptoms are very much linked or associated with the heart failures. And even if you see the medical history also tells about our initial diagnosis, like presence of myocardial infarctions, right? Presence of myocardial infarctions. So here all these informations that was given in the case are, you could say, the most important symptoms of heart failure. Now in the second questions it is asked, explain the physiological basis of symptoms and signs in the patients. So here I'll explain in a very brief way, like shortness of breath. What is the most important cause of the shortness of breath? See, it is mainly due to left ventricular failure. It leads to increased pulmonary venous pressures as blood backs up into the lungs. The first sentence you see, what actually happens in the left ventricular failure? Left ventricular failure leads to increased pulmonary venous pressures as blood backs up into the lungs. This causes pulmonary congestions. Pulmonary congestions means the accumulations of fluid as well as interstitial edema that reduces the lung compliance, and it also impairs the gas exchange. So reduced lung compliance and impaired gas exchange ultimately leads to the shortness of breath. Clear? If you see the nocturnal dyspnea, what is the main physiological event takes place here? See, lying flat increases venous return, right? So here there is a changes in the venous return to the heart. So it means there is a changes in the preload, right? So this preload act as the most important factors that affects the left ventricular activity, mainly the contractions of the left ventricle. Clear? That further rising the pulmonary capillary pressures. So here two things happen. One is the reduced capacity of the left ventricles, means the contraction capacity of the left ventricular muscles are reduced, and at the same time there is a changes in the pulmonary capillary pressures. Along with this, there is a fluid leaks into the alveoli, and this leakage of fluid ultimately worsens the conditions called the development of the dyspnea, and which is the most important conditions or information given in the case. So these are the two most important physiological bases that may be related with the developed symptoms of heart failure. I am not continue the rest of the part due to the shortage of time. In the next class we will try to continue the rest of the part. Okay? Which one? Yes. You can see here also. Here in this case, another important question asked, that is, what are the types and cause of the above disease? Yes, based on the diagnosis, you have to classify what are the most important types of heart failure. Here it is discussed about the left-sided heart failure and right-sided heart failures, and along with this, say about the possible treatment strategies. This one is one possible treatment strategies, mechanisms, effects along with the clinical impacts. This is another important treatment strategies. So here in this tutorial lectures, actually I tried to give a basic informations how to read the case properly, how to identify the most important informations given in the case, and based on the informations given, how to diagnose, if you diagnose the case, and what should be your justifications. Okay, thank you.